This research is about an approach to communicate health literacy among adolescents, with a focus on the Health at School program. The ultimate goal of health promotion programs is to improve health outcomes for communities. Health promotion provides a key opportunity to empower young people to make informed choices regarding key health-related behaviors such as tobacco and alcohol use, dietary choices and physical activity. Lacking knowledge among adolescents affects their understanding of some problems related to health. The Health Promotion School approach is a key intervention strategy to strengthen health resources and promote healthy lifestyles. It moves beyond individual behavior by also aiming at whole system changes. It might have a positive influence on school environment, relationship of school with community and the behavior of children. Review of effectiveness of health promotion school framework showed effectiveness in some of the interventions like reduction in students' body mass index, changes in physical activity, improvement intake of fruits and vegetables, reduction in the use of cigarette and reduced incidence of being bullied. Consequently, there was the need to start the Initiative of Health in Schools program. The Health in Schools program was implemented in Brazil in 2007, through Presidential Decree No. 6.286/2007. Consisting of a partnership between the Ministry of Education and the Ministry of Health, constituting an intersectorial policy. This program aims to contribute positively for the training of health and education professionals and students, in addition to enabling prevention, promotion and attention to health. School is a privileged place for development of preventive efforts because it is a place where teenagers spend most of their time, enabling promotion and prevention strategies, and it is the gateway preference of the health system, which makes it believe that this partnership education/health bring better results in addressing such a delicate and common theme in the daily life of adolescents and their families. However, working with adolescents in a healthcare context can be challenging, and one of the most important focuses is to overcome potential communication barriers between adults and adolescents aiming to promote their health. The question is how programs such as health promotion schools and health in schools can provide health literacy at a level that can be understood by students to keep them engaged in their own health promotion and decision making. The use of technology may facilitate the communication with adolescents, but what should be considered in the design of this tool? How the content of communication should look like. It is important to design an effective tool to communicate with adolescents, creating a communication strategy promoting health literacy and well-being. To address this question, we use the concept of person-centered care design. This design comprises two dimensions: care and priority objectives, meaning to respect and appreciate of each person as a unique, valuable individual in the enabling environment that promotes or hampers these objectives. Various instruments have been developed to assess this design, which can be classified in three groups: systematic observation of the care delivered, survey targeting service users, and surveys targeting health professionals. Theoretical foundations for this research is divided into three directions: health promotion for adolescents, innovation in adolescents, health promotion and communication with adolescents. First, health promotion and adolescence. Adolescence is a gradual transition between childhood and adulthood, characterized by physical, psychological, social and comportmental changes. It is also characterized by the need for social integration, the pursuit and personality development, and the discovery of limitations. Alongside these changes, it is growing the autonomy and independence from the family, and also the experimentation with new behaviors and experiences that may represent significant risk factors for health. These factors predispose the emergence of infections, unwanted pregnancies, accidents and violence, as well as vulnerability to chronic non-communicable diseases, such as obesity and dyslipidemia. Adolescence is the period where several habits and behaviors are established and incorporated, and possibly they are transferred to adulthood, making them more difficult to be changed. It is important to motivate the adolescent to become an active subject of his own care, using for this, health education strategies that aim at promoting health, prevent damage, and practice of self-care. The information delivered to adolescents has to assume the role of prevention and health promotion. It is believed that adolescents may act more consciously when facing external pressures if the previously administered informations were shared correctly and completely. Not only informing the negative effects, but also explaining that there are momentary pleasures which may cause in the future anguish and suffering. School occupies an important place in the development of orientation activities, freedom of expression and health education. It is essential that these actions occur continuously with content and diversified methodologies that respect local and regional characteristics. The Health Promotion School strives for improving the health of teachers, children, families, and community members. Bring an awareness among the community leaders about the contribution of community towards people's health, and it can lead to better chances of improvement of children's well-being. The second theory is about innovation in health promotion for adolescents. Innovation is key to confronting the vast majority of issues facing humanity in many fields such as business, economics, education, engineering, management, manufacturing, and many more. Many researches highlight several current and potential innovative applications for new technology and social networking in health promotion, considering technology access among adolescents and young adults. Nowadays, most adolescents own cell phones and spend several hours per day using them. Some educators and counselors use smartphone-based communication to reach out to adolescents in need and to offer them emotional support. Health promotion can be delivered through new media channels such as websites, social networking, text messages, video sharing, game cell phone applications, and QR codes. There are potential downsides of technology and new media such as addiction. But despite these challenges, the need for innovative, informative research in the field is greater than ever. The third theory is about communication with adolescents. Communication barriers are especially problematic as many leading causes of mortality and morbidity in adolescents are preventable. Previous studies reported that communication barriers existed when revealing sensitive and personal aspects. Participants expressed feeling worried for being misunderstood, belittled, or judged. They described that when they experienced an authentic intention for caring, this contributed to building a sense of trust with the educator. Engaging adolescents in handled correctly, this can reduce the sense of uncertainty and enable adolescents to maintain emotional safety, thus making it easier for them to readily discuss their health-related concerns. The emergence of smartphones has provided children and adolescents with unlimited access to the internet along with multiple communicative and recreational applications. Online communication platforms are perceived as a comfortable setting for emotional self-disclosure. The most communication techniques in which health field is interested are tailoring the message, targeting the message to audience, using narratives, and framing the message. The research design is planned to work with adolescents enrolled in public schools, teachers, and health professionals. After presenting the research proposal to the Ethics Committee of UFABC, working in the form of surveys, interviews, and scientific resources, data extraction will be used, followed by data analysis and validation. Expected results of this research is to focus on the Health in Schools program initiatives aiming to create a person-centered care design linking between health promotion and education, increasing literacy of health in adolescents. The applicability of the actions foreseen in this program through intersectoriality between health and education sectors, in promoting environments prevention and elaboration of coping strategies, as well as inclusion and approaching transversal themes within schools, in order to contemplate the whole school community from the perspective of networking. A special thanks for Professora Luciana Pereira and Professor Anderson Ribeiro for their tremendous help and support. This research proposal is done by Bosma Jalit for the Postgraduate Program of Engineering and Innovation Management in UFABC Santo André for entrance of the academic year of 2020.